Ah, the beautiful intense smell of peeling an orange. That's what comes to mind whenever I open a bottle of sweet orange essential oil. Interestingly, most people, but not all, like sweet orange. In fact, during a training session, a group of nurses likened it to their cleaning solution. Yes, it's used in commercial cleaners and is great to use in your homemade cleaning solutions, but let's look at how it can be used in a clinical setting. It will be helpful to have the sweet orange monograph reading from this lesson available as a reference as we review the following information. First, look at the botanical name so we all know what we're referring to. You can review other sections of this monograph on your own, but for now, we'll look at the chemical constituents and therapeutic actions of sweet orange, or Citrus sinensis. Notice that the main chemical constituents are monoterpenes. What's not shown here is that most of the monoterpenes are limonene, which are very prone to oxidation, as are other citrus oils. Do you recall from a previous lesson that oxidated oils can be very irritating to the skin? Appropriate storage of the essential oil and paying attention to the shelf life is particularly important for all citrus essential oils. Now, as we look at the main therapeutic properties of sweet orange, you'll see antidepressant, antibacterial, antispasmodic, digestive, lymphatic stimulant, and sedative. While sweet orange is typically thought to be uplifting, which is why it's listed as having antidepressant properties, it's also known to be sedating. The antispasmodic and digestive properties of this oil may be the reasons that some people find it helpful for abdominal cramping and nausea. References that give more details for therapeutic properties often list sweet orange as normalizing or stimulating peristalsis. All citrus essential oils have great antiseptic properties, and sweet orange is no different. Notice it's listed as antibacterial. This is why it's in so many cleaning products. However, this is not the typical reason sweet orange is used in a clinical setting. Remember, it's generally the known therapeutic properties that could be used to aid symptom management. Safety considerations of sweet orange are related to its topical use. Oil that is generally less than a year old and has been stored appropriately is non-toxic, non-irritating, and non-sensitizing, as long as it is properly diluted. However, as you know, it's prone to oxidation, and if you recall from the safety lesson, this means it could be a skin irritant and cause sensitization. Now it's your turn. We've discussed lavender quite a bit in this course. Let's see if you can analyze a monograph and determine how it can be used in the clinical setting. It will be helpful to have the lavender monograph reading from this lesson available as a reference as you reflect the following questions. What are the main therapeutic properties that you would consider using lavender for in a clinical setting? Identify a patient or client you would use lavender for. Both sweet orange, Citrus sinensis, and lavender, Lavandula angustifolia, have chemical constituents that are effective for relaxation. Sweet orange may not be the first essential oil to think of for nausea, but keep it in mind as one that just might be effective. Lavender is also a go-to essential oil for sleep and pain, but keep in mind that not everybody likes the scent. It's time to apply what you've learned in a case study. See what you would do for patient John.